can't believe I'm doing this, but I'm going to be debunking John Stossel on single-payer healthcare. That's scary, dog. Okay, let's get to it then.
In America today, we're told people have a right to health care.
Health care should be a right.
A right to all.
It's pretty basic. It's just the right thing to do.
Health care should be a right.
The real question is who pays for it. And that's really not a rights question.
Chris Pope of the Manhattan Institute City Journal studied...
What do you mean it's not a rights question? What does that even mean? Like, seriously, what does that even mean? I don't know. Let's keep going.
Healthcare around the world. Some countries have single-payer systems, meaning government pays for everything. That's what progressives want for America.
Never again in America does anyone go bankrupt just because they got sick. Never.
What single payer would do is it would make the government responsible for everybody. Instead of the government being able to focus its resources on the gaps in coverage, on the people who can't provide for themselves, the government would actually end up spending most of the money on people who are perfectly able to purchase their own insurance.
He said the government won't be able to focus on other resources. Medicare for all would literally stop people from dying. What is he talking about? And on top of that, I mean, you got Yale, you got the University of Mass and Amherst. Hell, you even got a Koch brothers study that says Medicare for all would actually save us trillions of dollars. So I don't know what he's talking about.
In England, France, Germany, they have single payer and they're happy.
Well, that's really not the case. In Germany, employers provide most of the healthcare and fund most of the healthcare just as they do in the United States.
In France, too.
There are private insurance companies, employers fund healthcare, people pay out of pocket the same way that they do in the United States.
So who does have?
The French-style system, actually, like 77% of the people in France's healthcare coverage is covered by the government. They have private businesses, but the government is the single payer for the most part. So I don't know what he's talking about. And on top of that, France is one of the best healthcare systems we have. And in the Nordic countries, I think it was Finland who was number one in the healthcare. Some of the best healthcare systems are government funded and publicly funded. So the idea that socialized healthcare, and we're not talking about nationalizing the industry. We're talking about the French-style system where you have private insurance companies still giving people the care, and then you have the government funding that health care. So you're still going to have competition, and you're still going to have people benefiting off of health care, and it will still have innovation and opportunity for everybody.
Single payer.
Canada, Norway, England.
They have good outcomes in Norway, England, and Canada.
In England, there is rarely a week that goes by without a crisis or another in the healthcare system being part of the news.
Britain has nationalized their healthcare system. That's what the NHS is. So, like I said, I'm not for nationalizing it. We shouldn't nationalize it. So
this year, there was a crisis in emergency room care. People left in the hallways for hours and hours.
Admitted in terrible pain, having broken her back, she spent 6 days and 6 nights on a bed in a corridor.
Doctors on strike, nurses on strike.
In Canada, too.
The average length of stay...
To be fair to UK's problems, they're strawmanning like elective surgeries and stuff. At the end of the day, if somebody goes to the ER, they're not going to say, hey, you're number 25. No, they're going to be instantly taken care of. So they're not being really honest about what specifically they're talking about. But again, I mean, I know the NHS has problems, but I don't want to nationalize it.
In an emergency room is 4 hours. 1 in 10 people have to wait more than 8 hours.
What happens when you start thinking of a single payer system is you start allocating healthcare resources like a politician. You start thinking, well, what's serious enough to care about and what's kind of not such a big deal?
With public money.
They don't talk about the wait times. I mean, the wait times vary, but there are also private insurances that have just the same amount of wait times. So whether it's private or public, You have to ration the care somehow or another.
You should.
But it turns out that the government will try and deny care or impose really long waiting lists in the hope that people...
He's talking about the government denying care. Again, this is just nonsense. If you get stabbed, if you get shot, you're going to be taken care of instantly. He's talking about public government-funded healthcare not providing services. A Harvard study says that 45,000 people die annually due to a lack of healthcare coverage in the United States. So don't talk to me about... He's not being honest with this. He's talking about elective surgeries and stuff.
Won't seek treatment. Do they need knee replacement? From a politician's point of view, it's not going to kill them, and you could save a lot of money by not providing it to them.
In Britain, people buy private insurance to cover that.
About 15% of the population purchases private insurance.
But private insurance is what single-payer advocates want to get rid of.
The private insurance companies don't like this idea. We're going to put them out of business.
Put them out of business.
Well, it makes you wonder whether this is more about spite than it is about improving people's health.
The drug companies that are ripping off the American people and charging us the highest prices in the world don't like the idea. Tough luck.
The cost of drugs is really quite cheap compared to even a night in a hospital.
In England, people don't get billed for such expensive drugs. But often that also means...
Whenever a new drug comes on the market that can save lives, the government just doesn't have the funds to pay for it.
The sick person may never know about the better treatment.
Services that you would have access to in the United States, you're just entirely unaware of them.
But what about poor people who can't afford these services?
The United States certainly does more than other countries.
I hear we do less.
Over $1 trillion a year in public spending, really, to provide healthcare to people who don't afford it.
American emergency rooms treat anyone who comes in, and Medicaid pays for health care for poor.
Yeah. Only the United States ERs. They're the only ones who do that.
Poor people. In addition,
we have the Medicare program, which provides care to...
By the way, I was being sarcastic.
Another 50 million.
So just leave it the way it is?
There are certainly a couple of areas that we can really improve things on. More competition between hospitals.
We have competition between hospitals.
We don't really. It's very hard to set up a new hospital.
Many states forbid it unless a board of
Hey, listen, I'm all about the free market. I'm still a capitalist. I think I know what they're going to talk about, but let's keep listening.
called experts determines that there's a need.
The people who will be on these boards will be the hospitals that are already in the state. And so the hospital industry is a bit of a cartel.
His main suggestion, allow more...
We need to deregulate and only put regulations where they are needed in the hospitals and in healthcare. Like, there are some regulations that we really need, and then there are just some serious regulations that we really don't need. And right now, as we have it set up in the United States, we have it so that it's special licensing. You have to prove to the government that your hospital is needed. I mean, if you have the services, if you have the care, what else do you have to prove? You know what I mean? So this is basically crony capitalism at its best. I don't think anybody agrees, especially leftists, that we should be having a special licensing system where there are healthcare lobbyists that can lobby government and get special treatment. I want to end lobbying. I want to end corporate welfare. We need to reinstate real capitalism.
For people to choose their own healthcare plans.
We currently have a system based on employers picking which healthcare plan is good for employees. If we move towards a healthcare system where individuals were more responsible for shopping around, people would choose a better system.
Consumers hear that and say, I can't keep up with this stuff. I'm not smart enough to make the decisions about where I should spend the money. I want experts to do this for me.
Everyone knows what a good hospital is in their area. If you're an individual shopping for healthcare, you're looking after your own interests.
Under our current system, government and insurance companies spend 7 out of 8 healthcare dollars for us.
The question is, do we improve on the healthcare system by empowering consumers, or do we basically just say, this is the government plan, deal with it?
If this is the government plan, should we just deal with it? You're getting free healthcare, man. You know how much healthcare costs in this country, over 135 million Americans struggle with medical debt. One of the biggest bankruptcies we have in this country. Healthcare is so expensive. You get rid of that cost, people are going to be so much better off. And they're talking about taxes. First off, it'll be affordable to not only implement Medicare for all, but social democracy as a whole, depending on how far you want to go. Like, I want to do family paid and maternal leave, Medicare for all, free college, and jobs training, and universal daycare. Maybe Social Security for all or Social Security expansion. But either way, these things are affordable and cheaper. So, and on top of that, we're still talking about keeping the private businesses. Like, they mentioned the NHS a lot. We don't want a nationalized industry. Again, I'm a capitalist. We need to have innovation and we need to have opportunity. So let's keep the private insurances, let's keep the competition and innovation going, and let's just give everybody a card and say, here, now you can go to whatever business you want. But this idea that private insurance is better, it's not. I mean, private insurance can be great at giving the care, giving quality care, yes. And we've seen that with, the top 5 countries in the world have publicly funded healthcare or government funded healthcare. So you can't say that only private insurance works. And on top of that, the VA and Medicare are consistently ranked as some of the best healthcare systems in this country. So this isn't a debate anymore. It's a flawless victory. Okay, we gotta stop we gotta stop talking about privatizing things like education and healthcare, because at the end of the day, the market has no incentive to help you when it comes to that. And on top of that, it's going to be expensive. These are things that are considered privileges now. So over 30 million people don't have healthcare, guys, during a pandemic too. Is that what we really want for this country? I mean, God only knows what the numbers are going to be next year as far as deaths go. In the middle of a pandemic, we don't even have Medicare for all or UBI. So it's affordable. It can be high quality care. It's still going to be private business. As far as all the free market stuff, for the most part, I agree with him. Like I said, we need a much more free market system. We need a capitalist system. Like, I love the idea of gallbladders are us, and we can still implement that under Medicare for all. We fund it, give people a card, they can choose whatever doctor they want, or they can keep whatever doctor they have right now. So let's do better. Let's stop having a system that screws the working family and the working American. 45,000 people a year die from this. Let's just do this, guys. Like, there are certain things, don't get me wrong, the government should be shrunken massively as much as possible, but there are also places where government does extraordinarily well. And Medicare for all is exactly what we need and exactly what we can do and afford.